Hey all, good evening to each and everyone over here. I'm thrilled to welcome you all for today's informative webinar on artificial intelligence and oncology. I am Gagana Ballari, manager from Mediversal Academy, and I have the privilege of introducing our esteemed speaker for today, Dr. Pradeep. Dr. Pradeep is a renowned expert in the field of radiation oncology with 13 years of experience. Dr. Pradeep is graduated from Osmania Medical College, Hyderabad, and specialized in radiation oncology from HCG Cancer Care Center, Bangalore, the best cancer hospital in India with advanced technologies and leading cancer care provider in India. He has been trained in high precision radiotherapy techniques like cyberknife, tomotherapy, SRS, SBRT, VMAT, IGRT, IMRT, TBI, and HDR brachytherapy. He has also received specialty training in urologic oncology and gastrointestinal oncology from the world renowned Memorial Sloan Kettering Cancer Center in the United States, considered as world number one cancer center. He has received advanced training in certification in thoracic oncology (CTO) from the University of Michigan in the United States (USA), certification in precision oncology (CPO) from the University of Geneva in Switzerland, certification in cyberknife CNS and physician training CCPT from Accurate, USA with expertise in treating cancers with robotic radiosurgery. Thank you. Over to you, Dr. Pradeep.
Okay, thank you everyone for joining this nice session on artificial intelligence in oncology. And nowadays, everyone is very much interested in this new buzzword in the town, and we are trying to see this application every field which we are living in, and also it has been infiltrating into the healthcare industry. So, in this prospect, we are also looking into what are the chances of this artificial intelligence and the gains we get and the challenges we have when utilizing this artificial intelligence, especially for the cancer care, that is oncology. So let's go into this and see what exactly is this. First of all, artificial intelligence, it is nothing but utilization of the machinery, computers, processors, and their processing algorithms in creating some benefit to the existing technology or existing work. So it has made significant advances in the fields of oncology, offering various applications that can improve cancer detection, diagnosis, treatment, patient care. So why is it in the news? Because of its healthcare has become so complicated nowadays that there are so many things that need to be taken care of at the same time in multiple arenas, and the work becomes cumbersome. And also there need to be a lot of new technologies which can
Excuse me,
ease the
sir.
work of. Hello. So because of so much complicated issues in healthcare and the technology that has been driving every part of it and every new advancement in the treatment modalities need lot of extra auxiliary things that can ease off the work of every person involved and also the systems. So artificial intelligence, it is when computers and other machines mimic human cognition. That is where the issue of artificial intelligence comes. We do have a lot of machines that take care of so many works, but how do you have something that needs some cognition of human be removed from its part so that we don't need to oversee? That is where the human cognition mimicking machines or the algorithms that run these machines come into act, and these are capable of learning, thinking, and making decisions and take actions. So this is all the core artificial intelligence, and it is in healthcare as an umbrella term to describe the application of machine learning, algorithms, and all the cognitive technologies in the medical settings. So application of artificial intelligence in healthcare is very much widespread. As you can see on the screen, it right away starts from initial early diagnosis, testing, then screening, drug development, medical diagnosis, any error reduction in dosages, cancer research, personalized healthcare plans, virtual nursing assistance, even after the treatment patient goes home. And there are so many things that can help him alleviate his pain, give him some motivation, etc. And also in gene editing, that is a even more advanced technology that is being developed now to manipulate the genes to cure some genetic diseases. And also robotic assisted surgeries, now they are also trying to utilize the artificial intelligence. Along with this, if there are any large data that has been in the hospitals and also the systems that has been used, example radiation oncology uses a lot of machines, and if something goes wrong in even the program of it, the whole treatment goes completely haywire. So even to prevent this, there can be double checks using artificial intelligence. So it is in every aspect of the healthcare. If you want to utilize, there is some portion that can be catered to artificial intelligence. So we have been talking about this. So what is its scenario in India? Are we really up to the mark in grabbing the advantages of it? It is one of the few developing countries, as we are seeing, and now AI is also rapidly growing into every field in India. And as per the projections, by 2025, there is a lot of market that has been inculcated into it. Almost around 12 billion US dollars is being spent on AI in the primary sector, and GDP by 1 trillion by 2035. So in the healthcare market, as per the projections by 2025, in Indian healthcare industry, it is estimated to grow as per 50% during the forecast period. So this shows how much eager everyone is to grab this opportunity, and also the opportunities that it is going to provide in every area of the healthcare. So some successful models as of now we are seeing in the preliminary stages, the new startups which are trying to help the people to utilize this artificial intelligence in day-to-day healthcare life or fitness, etc. like Healthify Me, Tricog, Dozy, and Nirama. This is even more interesting because it helps in early detection of breast cancers using the thermal portions of the tissue that has been taken into systems, generate the algorithms using AI to say if there is a suspicion for cancer. So these new things are being successfully being launched and being run successfully. So we'll go through all of this as an overview. I'd like to go through these topics: early detection and risk assessment and prediction, the personalized treatment, drug discovery and treatment planning, monitoring and prognosis, clinical trials, patient support, data management. So everywhere, all these places, you have utilization of artificial intelligence. So how do we know that artificial intelligence helps us in early detection and diagnosis? The basic thing is AI itself means it can learn something from the data you provide. So the mammograms, X-rays, CT scans, MRI scans, etc. All the image data is fed into these machines, and they can learn from the gray textures, contours, shapes, variations in each scan, and the scans with the disease, scans without the disease. All these they take up, they learn a lot of things and compare a lot of variables, and they have now a data supportive of how to say whether there is a disease or not, how the prognosis can be done, and how worse is the aggressiveness of the disease. Every aspect has been formulated using AI algorithms. So this AI helps in identifying the subtle patterns and abnormalities. Even our human eye cannot find them in the very early stages, which are not even kept as a standard classifications. So that is very interesting to see. You can find something coming in the next 5 years, and you are trying to grab it now itself. Imagine how much the cure rates will be in cancer. So this AI can help radiologists and pathologists in making even more accurate and timely diagnosis. So for example, you can see this picture. The one on the left is taken 4 years back, and the artificial intelligence system has pointed out some suspicious thing which is normal to a human eye or to the radiologists who are seeing, as per the texture, as per the visual impact it is showing in the imaging. But after 4 years, it developed into a breast cancer. So until and unless it comes to this stage, human eye cannot catch it, or we cannot suspect it. So this is a really wonderful thing, because even 4 years before a breast cancer develops, if you are able to find it and detect it and remove it using the surgical methods or whatever the treatment methods that are available, you are totally preventing the cancer itself from developing. So this can act like a very powerful tool now into the bag of cancer prevention as well as screening. So this is one more example of the breast tissue you can see that is suspicious, that is identified by the artificial intelligence on the left side. And in one more lung cancer, see, you can see the texture. If you see in a normal CT scan, you don't find anything abnormal there, but artificial intelligence found there is some abnormal in the red area you can see in the left side CT scan of the lung. So slight area it has pointed out there is something wrong that can develop into cancer. And down the lane, as you can see, there is a lung cancer that has been developed. So it's pretty accurate, precise, and very, very sensitive in pointing out all these abnormalities, even though even before they develop into the level that a human eye can catch them up. So these are very much important and key for 100% cure rate or even preventions. So this is from the Google Artificial Intelligence module that has tried to identify different types of cancers. This is part of the lung cancer screening program, and it has found out something suspicious for cancer and something as not cancer, and it has a negative. And for human eye, that looked the negative part looked like suspicious for cancer. But down the lane, as we can see, the suspicious for cancer has been positively noted as a diagnosis for cancer, and the other thing as a false positive. So this can help even radiologists, especially the person who are budding radiologists who doesn't have much experience, to add this experience of AI so that they can accurately detect, diagnose, or suspect and eliminate false positives or false negatives. This is one more example of a prostate cancer that has been detected by the artificial intelligence module developed by Dr. Tugby. And for a human normal radiologist, it might not be showing as a abnormal thing. But for this AI suspected some area which has internally abnormal tissue that is developing as prostate cancer prospective. So these things help newer or inexperienced radiologists can add to their knowledge and boost their diagnosing capacity more precisely and eliminate false positives. In risk assessment and prediction, AI models can predict an individual's risk of developing cancer based on their genetic, lifestyle, environmental factors, and these can help in targeted screening and prevention strategies for high-risk populations. So, if these AI models have been filled up with all the genetic information, the lifestyle which we are living, and the environment factors that are surrounding a person, it can calculate the risk, how much risk he is going through for which kind of disease or which kind of cancer, and what is the prognosis and when he can develop. To that level we have developed the algorithms now, and these are very much useful in screening the population without wasting lot of extra resources. So as per this picture, you can see all the lifestyle variables like diet, physical activity, smoking, alcohol, etc. that can be taken into consideration, and physical and chemical factors like temperature, pollution, pesticides, food contaminants, all the carcinogens, and the social factors, their socio-economic status, including stress levels, and ecosystems where the global warming, dense population, built environments, including occupational hazards, everything are taken into consideration while calculating the risk. And it can predict what can be the level of damage that can happen on your DNA or onto your regular immune boosting procedures, or even the normal health, and it can project what adverse health outcomes can this person can have, or any chronic disease risk can they have, and what kind of cancers they may develop in the future. And you can target those specific risk factor related cancer screening programs to identify these cancers earlier or even prevent them. So nowadays we are utilizing all this information exclusively and deliberately to screen, prevent, and also to detect them in early stage, especially in the breast cancer, lung cancer, liver, prostate, ovarian, bladder, even the cervical cancer. All these are finding it very much useful to have this risk assessment and prediction. So the other part of artificial intelligence, it helps you give a personalized treatment to a person. For example, you think one person, suppose there are few people who are having, example, breast cancer or lung cancer who are on targeted therapies. One person may find it suitable without any side effects. The other person may have a lot of side effects. So these side effect profile may vary from person to person based on their responsiveness and their reaction to certain drug. So in such cases, identifying and personalizing the treatment, that is a tailor-made treatment for such individual, is very important. And so the artificial intelligence can take all the data regarding the primary disease what he has, and how much extensive disease or the spread metastasis is present, and what can be the other components that can be taken from his normal routine like liquid biopsies, paraffin tumors, and organoids that are developed from the tumors, and the xenografts. All these data can be fused and can develop the proteomic or metabolic analysis to say which type of drug has which kind of side effects in particular kind of person. So this level of to the point personalized treatments are now being developed, so the therapies are more effective and the compliance will increase, and the target therapies and immunotherapies become more and more useful and efficacious. In treatment planning, as you can see, oncology has corely three divisions: the surgery, radiation, as well as chemotherapy. The latest ones which are being added onto it are target therapies, immunotherapies, and gene therapies in the future. So you can see AI can assist all these oncologists in developing these treatment plans by analyzing the patient data, recommending the most effective therapies with the fewest side effects, as we have seen now in the personalized treatments. Also in radiation oncology and surgery, they assist the oncologist in various aspects to precisely concentrate on how to treat the local tumor. So we can see how it helps in radiation oncology. There is one more aspect called motion-free PET-CT planning. Here, the data from PET-CT taken during inspiration expiration through all the cycle of the respiration is being fused, and take a projection from this using artificial intelligence to see how much the tumor can vary along the respiratory cycle along the areas, and this all variation can be included in your radiation procedure to not miss the tumor while you are delivering the radiation. So this is one aspect where you can have, if these techniques are not used or the 4D gatings are not used, then simply you can either miss the tumor while there is a movement during respiration while targeting with the radiation, or you might be giving over radiation to the normal lung tissue which might be coming into the tumor area while respiration. So adaptive radiation therapy in the treatment of radiation for a lot of cancers is now being becoming the major aspect. This is nothing but adaptation of your treatment to the tumor, to the conditions around the tumor, and to the person being treated. So either there might be a movement in the tumor or surrounding tissues, or the tumor may shrink around, or the tumor may change every day based on the treatment it has received. All these aspects can be taken into consideration, and we have different types of adaptation: manual adaptation, offline adaptation, online adaptation. Now we have come to real-time adaptation. Artificial intelligence helps a lot in doing this real-time adaptation. While every day during the treatment, it takes account the shape, size, position, movement, and different characteristics of the tumor to see what is the area, how much dose he has to go in which area of the tumor, and what are the surrounding areas which should not be missed. And the treatment plan can be changed every day on time on the bed, on the treatment coach itself, without missing the target as well as without overburning the normal tissues. So this is the level of artificial intelligence included in the radiation oncology now. So you can see this is an example of lung cancer which I have treated before. You can see on the left side there's a large 7 centimeter mass in the lungs, and that is at the start of the treatment. And during the course of the treatment, the tumor keeps on shrinking because of the radiation plan. As you can see, after week 4, there is a lot of difference in the tumor size. If you keep on giving the same amount of radiation as you are giving at the same initial phase, you are going to include much of the normal lung tissue in the treating region as the tumor has shrunken now. So to adapt to these changes, you should be ideally changing the tumor contours to give the high dose only to the tumor region and microscopic dose or high risk dose to the other regions. So if you are utilizing artificial intelligence and adaptive planning, you can happily change the plans every day and to adapt to the changing contours of the tumor, so that you will be increasing your preciseness as well as saving the lung from getting more side effects. So this is the same patient. You can see from the other view how big it is at the week 0 and week 3, how much rapid change is there with the radiation. And this patient has undergone adaptive radiation along with artificial intelligence, utilizing the deformable registrations to change the contours every day. So it has benefited the patient a lot without having any lung issues or complications post the treatment. So the benefits of utilizing artificial intelligence and adaptive radiation can help improve the lung doses, heart doses, esophageal doses, spinal cord doses, and particularly in this case. So if even you are treating any part of the thing, you have a lot of help that can be gained from artificial intelligence utilizing in combination with adaptive radiation. So coming to molecular medicine targeted therapy, here the fine molecular and clinical characterizations of the person along with the prescribed medicine will be taken into care and stratified according to the risk groups, and thereby the convergence of artificial intelligence and the big data, which has lot of data already been taken from lot of general population who have utilized these medicines, and how what are the side effects they have got, and what are the improvements they have got, what is the prognosis, and thereby comparing these data you can provide them what is the best way, what is the best medication, and what is the best dosage they can take, so that they can be benefited for the treatment as well as having the less side effects. Coming to surgery, it has been growing a lot, and now people are trying to get into this arena also, how to utilize artificial intelligence for surgery in preoperative planning, intraoperative guidance, surgical robotics, all these areas. It can help the surgeon ease his cumbersome work of doing the surgery in a guided way. It can provide lot of guidance while doing complicated surgeries. Also, there are some other surgical robotics which can, like example, nano robotics, etc. They can directly go into places where the surgeon cannot access and utilize the artificial intelligence data to precisely identify these tumors where they are and how much area they have to do the treatment and come back. So it has been evolving a lot, and we can see in the future a lot of utilization of artificial intelligence even in surgery also. So what they do is they take up the all the data from the X-rays, ultrasound, CT, PET, or MR, all the imaging that is done pre-operatively, and also from the intraoperative guidance from the fluoroscopy, OR, MRCT, optical guidance, sensors, etc. And from there, the data is given to the artificial intelligence core, where it can be done under supervised learning or unsupervised learning, and it can gain some insights onto what kind of utilization you can use for it. For example, ortho, what kind of 3D shaping of the knee replacement area you have to do, or in some other places where the complicated surgeries has to be done in the abdomen, prostate, wherever, and you can utilize all this data to guide you during the surgeries in endoscopic visualizations or 3D environment mapping or soft tissue biopsy tracking, even neuro navigation biopsies can also utilize these things. So localization and mapping, system modeling, control, and human robotic interaction and perception. These are the four core areas which are being developed now. And one more beautiful thing is augmented reality. This can help in two ways. While surgeons who are in the learning phase, they can utilize this augmented reality to know to practice the surgeries without affecting the real-time patients, and can get experienced in that. And during surgeries also, in the places where it is very difficult to see and they need microscopic lens, etc., this augmented reality can help them project them into magnanimous levels to ease on the surgeon's part to go with the surgery very easily. And future of surgery, you have all these components being developed into AR and VR technologies, remote surgical cooperations that has been being planned. And also, as we have seen long back, like 1 or 2 months back, we have an example of somebody doing surgery, robotic surgery from a country, and the surgery being taken in a different country using Wi-Fi and artificial intelligence. All these are being slowly being incorporated into systems. So coming to monitoring and prognosis, the treatment of cancer doesn't stop there, and after treatment also the patient has to be continuously monitored, follow up, and prognosis also has to be kept in mind. So how do we know which patient has bad prognosis or good prognosis? Till now we have limited data like what is the age, what kind of histology it is, how aggressive it is in the histopathology or in the CT scans. But AI has given more insights because of a lot of information that has been put into the systems from different kinds of prognostic patients and all. Now, even in some critical place where we cannot do biopsies or where we cannot do IHCs or there is limited tissues available, how can we project them? Example, you can see here, this is a glioblastoma, that is a brain cancer patient. And generally in MRI, you cannot know the mutation status and all. But from the AI data, clearly you can see this patient has been identified as IDH mutant glioblastoma. So the prediction levels have been increased, and this can help even in cases where there's a financial crisis or unavailability of these genetic testings. You can utilize this data and these artificial intelligence algorithms to see if any mutations are there, like IDH mutations, and any extra benefit from additional medication given during the treatment. Even in pathology, as per this hormones AI model, you can see there are distal images of a bladder tumor. See, generally bladder tumor, if it is there, people think excising that part which is visible is enough. But there can be microscopic spread which may not be visualized. And further, generally we could go for estimated radiation in the high risk regions. But in pathological tumor segmentation, if you are utilizing artificial intelligence models, they can develop multi-resolution prediction maps to see which areas have the high core tumor burdens and which areas there can be a lymphocyte prediction map, and overall risk of the patient, is it high risk, low risk for spreading to other areas. Thereby you can utilize this information to have an adjuvant therapy or concurrent therapy based on the microscopic tumor spread. So in pathology, as you can see, it takes up the lot of data from the histopathology, the variations, the tumor depiction, the types of cells involved, the quantity of cells, the concentration of different immunity cells, and etc. All these picturizations can be harnessed and developed into specific algorithmic models to help you identify the risk assessment of the patient as well as the prognosis. And also utilizing this in the gene sequencing and utilizing for different kind of high risk, low risk prognosis as well as diagnosis. You can utilize either whole genomic sequencing, process all the data, and utilize it through artificial intelligence and bring it down to what is the diagnosis and what is prognosis. Or you can do a targeted sequencing, which actually till now, like breast cancer, P53 or that other tumor suppressor genes, etc., KRAS, lung, BRAF, all these limited things you can take and you can develop. But if you are utilizing the NGS sequence and artificial intelligence, you are utilizing a whole set of genomes. So you may be able to discover some newer splicing variants of the cancer which may not be already made standard. So this way, in the future also, if any small variations in such variant genes are there, you can find the risk patients and follow up them even in early stage itself. Clinical trial matching, artificial intelligence can help match eligible cancer patients with appropriate clinical trials, and they can also increase the access to experimental treatments as well as advancing research. So in clinical trials, they help in study design, study setup, supply, data management, data analysis, and they actually make the process very quicker instead of going through a lot of time and a lot of cumbersome works. Because of utilization of the previous existing works and matching capacities of the artificial intelligence and machine learning, the clinical trials can be fast forward to bring out a new drug even more faster. So even the cancer research, all the complex problems in oncology can be pushed to this AI or machine learning, and they can go through different levels of multi-level programs, CNNs and RNNs, that is neural networks, etc. And they all transfer this learning and add in with the different types of learning like topological, visual, federated, etc. And they can reinforce the existing cancer research learning to bring out the solutions even more faster. Treatment of any patient, including cancer patient, doesn't support with follow-ups, and once the patient goes home, they need a lot of support, and they need to be educated about the things which they can do, which they cannot do, what are the warning signs, they have to come back to the doctor, and all these places where there will be cumbersome human involvement can be removed, and using artificial intelligence with some virtual assistants and chatbots where they can give regular information, regular encouragement or emotional support and guidance without being run to the hospital for every small thing. So this improves the quality of life of the patient as well as time saving effects. So these are the top 5 places where you can have patient engagement, like AI powered patient self-service portals, healthcare virtual assistants, 360-degree view of the patient, and risk assessment for preventive care, healthcare workforce automation. These areas, now there are a lot of apps being developed to help the patient to have his follow-ups and medical long-term medical care ease off. And in data management, as you know, it can help in manage, analyze vast amounts of patient data, including the electronic health records, imaging data, pathology reports. For example, if you are doing a clinical trial, clinical research, you might be having some thousands and thousands of patients, but you don't know, it's very cumbersome to manually do every small work, go through each patient and retrieve certain types of data. But if you are utilizing artificial intelligence, it can add to your existing filters and also come up with new ideas of your queries to immediately get what the filter data you want. So all these complex technologies being utilized in treatments now need quality control. Without that, the treatments can go haywire. Maybe variations, whatever you want to treat, maybe the treatment may change on the machine itself. So for all this, there requires a quality assurance, and artificial intelligence can help a lot in keeping these things in check and quality control in every step possible so that the treatment goes perfectly as planned. So as of now, in clinical practice, the artificial intelligence has been much utilized, especially in the oncology, in cancer radiology, pathology, radiation oncology, gastroenterology, clinical oncology, and gynecology. These are the areas where the FDA has been approved in America also, and a lot of applications, including devices, have been made and being utilized in these core areas of the specialties. And in different types of cancers, as you can see, all overall general cancers, lot of utilization is there, and breast cancer and lung cancer, lot of utilization because of the mutations available in the targeted therapies that are being developed. In these areas, there is a lot of utilization of artificial intelligence. And after that, prostate, colorectal, brain tumors. So this is the percentage of how much the artificial intelligence is being utilized in these types of cancers in specialties for in regular patient care treatment as well as the long-term follow-up. So, in conclusion, it is important to note that why artificial intelligence holds great promise in oncology. Also, it comes with a lot of challenges which need to overcome, and judiciously use artificial intelligence in the way it can ease the human involvement and workforce. This need for large and diverse data sets, regulatory and ethical considerations to be always kept in check, and integration of these AI systems into clinical practice is still a long way to go. And the future for AI, with the ongoing research and development, continues to drive the advancements in cancer care, and also it can offer potential improve in the improvements in the outcomes to cancer patient. And in the future, I can see it's always a tailor-made medicine or the precision medicine that is being generated or developed as a particular precise care plan for each and every patient. Thank you. Any questions?
Before we conclude, we would like to open the floor for any questions you might have. Please feel free to type your questions in the chat box and we'll do our best to answer them. Thank you, Deepthi Yadav, for your valuable feedback. Thank you, Dr. Prashant. Very much detailed presentation and awareness on AI in medicine. Thank you so much.
Thank you.
Thank you, Deep Clinic and Physiotherapist Center, Danori. Thank you so much for your valuable feedback. So thank you all for joining us today. We hope you found this webinar informative and valuable. If you have any further questions or would you like for more information, please feel free to reach out to us. Additionally, we will be also dropping a link in the chat box for you to fill out and submit to receive your certificates for the participation. Don't forget to follow us on social media for updates on future webinars and events. Have a great evening. Thank you so much.
Thank you, everyone. Hope everybody got something. And if you have any questions, you can always reach out to me.
Yeah, Dr. Bagal will be sharing the PPT in the group. There is one question, Dr. Pradeep, from Biswajit. How AI can help in pharmaceutical field like drug discovery?
Okay, in drug discovery, artificial intelligence is being utilized now. Initially, before developing any chemical for certain type of disease, they would like to put almost all available proteins to target that type of disease, or what is their target, like is it some receptor, is it some kind of hormone, something. But it becomes a manual thing. They have to go through a lot of match, mismatch, everything in a trial and error. But now later on, we have got computers which are trying to simulate the systems. Now we have got the artificial intelligence involved in this system. Like you give the characteristics of the disease, and you can give the characteristics of the protein which you are trying to give, or you want to find some combination of a protein chemical, even that it will automatically find some suitable protein, the drug chemical which can exactly have an interaction with the diseased tissue which you are trying to target. Thereby, the first step, which takes a long time to identify a protein which can have some impact on that disease, can be identified. From there, you can take on to the different phases of the clinical trials.
Thank you, Dr. Pradeep. Dr. Pavitra, please kindly unmute yourself and ask the question. You're raising your hand. Okay. I hope there are no questions. So, thank you so much, Dr. Pradeep, for your valuable session. And
Thank you.
uh, please fill the form which we have dropped a link in chat box for the certification of participation. Uh, Dr. Sridevi, please unmute yourself and talk.
Namaste, madam.
Yes. Namaste.
My name is Sridevi, madam. కర్నూలు నుంచి మాట్లాడుతున్నాను.
Okay.
అయితే నా హస్బెండ్కి క్యాన్సర్ సార్, మన ప్యాంక్రియాసిస్ క్యాన్సర్ అది చెప్పారు.
Okay.
అయితే ఫస్ట్ ఆపరేషన్ అయిపోయింది సార్. మళ్ళీ కొద్ది రోజులు బాగానే ఉండే, మళ్ళీ ఇప్పుడు లివర్కి వచ్చినాయని చెప్పారు సార్.
Okay. మళ్ళీ పెట్ సిటీ ఏమన్నా
అయితే
తీసు-
సార్,
ఓకే.
అయితే ఆ, ఆయనకి స్టన్స్ వేస్తామంటున్నాడు సార్. ఇవేమంటారు, ఆ, ఏమంటారు,
అదే ట్యూబ్ లాగా పెట్టి బయలు చూసి తీసేస్తా అని చెప్తున్నారా?
ఆ, అవును సార్ అన్నారు. ప్లస్ ఇంకోటి ఇది జాండీస్ వచ్చినాయి సార్.
ఉమ్.
జాండీస్ వచ్చినాయి, ఆపరేషన్ చేయాలంటున్నారు. దానికోసం భయపడి అనురాధ మేడంకి కాల్ చేస్తే ఇట్లా జాయిన్ కామని చెప్తే జాయిన్ అయినాను సార్.
అది ఒకసారి రిపోర్ట్స్ పంపించండి అమ్మ. ఎందుకంటే ఒకసారి లివర్కి వెళ్ళిందంటే మాత్రం ఫస్ట్ బిల్ రిబన్ ఏదైతే పెరిగిందో అది తగ్గించేయాల్సి ఉంటుంది. అది తగ్గించడానికి స్టంట్స్ వేస్తారు, వేయించండి మంచిదే. లేదంటే ఇక్కడికి వస్తే మనం కూడా చూడొచ్చు. అండ్ దాని తర్వాత ఫర్దర్ కీమోథెరపీ తీసుకోవాల్సి ఉంటుంది.
సరే సార్.
సో హోప్ no more questions, we can wind up this, right?
Yes, yes. Sure.
Thank you everyone. We'll have a new session again.
Yeah, thank you, Dr. Pradeep, for your valuable session. Uh, Kindly please fill out the forms for the certification of participation. So, thank you all for attending the session. We are winding up the session for the day. Thank you so much. Have a great evening. Thank you, Dr. Biswajit. Uh, Kindly fill the form and please leave the meeting. We are winding up the session.